African Partnership for Health is a coalition of African community leaders, African community members, and healthcare providers. Um, we come together to talk about the health of the African community, access to healthcare, and with the wellness of the African community in Portland in general. Currently, we're doing, you could call it a research on the community to begin to have to understand the needs of the community and to set priorities. So right now we have three ways of doing this work. One is we're doing outreach within the community. The outreach is to community members, community organizations, community leaders, and healthcare providers. Then we also do quantitative research, which my partner also does, where she goes to government agencies and wherever we can find data on the health of the African community and access to health, the numbers of the African community and whatnot. Just begin to understand what numbers are out there. And then third part is a we call them house meetings. We're holding about 20 to 30 house meetings, which will start in August and will go on to about the first week of November, where we host house meetings from for about 5 to 8 members of the African community, different sectors of the African community. So we have a broad understanding of what health issues are in the community, what the needs are, and what the concerns are of the African population. These meetings are held or facilitated by the African community themselves. So we have facilitators that are Africans, that are community leaders that talks to the community to begin to understand what the health needs are. These house meetings are going to occur in two phases. So the first phase, we gather data and we try to understand that data. And if we have questions, then we have the second phase to answer those questions. Um, all the information, all the data we collect from this research is going to be put together first week, second week of November, and we'll hold a community forum. Here, the community would decide what sets the priorities from all the data and all the information we've gathered, set priorities for the African community. What are the health priorities for the African population? And from there, begin to strategize how do we address these health priorities. So, ways we need help is the African community participating in this research, having more people get involved in the APH initiative, and whatnot. So, if anybody needs to contact me, they could reach me on my cell phone. That's the easiest way because I'm always moving around in the community. It's 503 200 8496. Thank you.